Good afternoon, everyone. First of all, I would like to acknowledge Newfoundland and Labrador's Child and Youth Advocate Jackie Lake Kavanagh, who is here today for this announcement on those important amendments to the Child and Youth Advocate Act. I would also like to acknowledge Cabinet Ministers and MHAs who are joining us here today, along with staff from my Department of Children, Seniors and Social Development and the Office of the Child and Youth Advocate. The protection and advancement of the rights and interests of our province's most vulnerable children and youth is a tremendous responsibility. I would like to take a moment to recognize the work of the Office of the Advocate. Your role in individual and systemic advocacy, education and promotion, reviews and investigations, and the recommendations you advance to government supports our combined improvement of programs and services to children, youth, and their families. We welcome all your recommendations and will continue to work in conjunction with you to meet our collective goal. And I want to thank you for all the work you do toward ensuring the best possible care for children and youth in our province. The safety and protection of our children and youth is a critical focus for our government, and we are firmly committed to delivering high-quality child protection services. Over the past several months, I have had the pleasure of meeting with many of my frontline social workers and discussing some of the complex issues that they are addressing. On a daily basis, our social workers are intervening with children and youth in situations of physical, sexual, and emotional abuse. They are highly trained professionals who use their assessment skills and practice experience, complemented by strong supervisory support to make clinical decisions. In recent years, the Advocates Report have recommended the development of a protocol with the Department for the reporting of critical incidents and deaths involving children and youth. In November 2014, the House of Assembly passed a motion committing to legislation to respond to the Advocate's request for the mandatory reporting of critical incidents and deaths to the Child and Youth Advocate's Office. In December 2015, the Department of Children, Youth and Family Services, now Children, Seniors and Social Development, was mandated to develop legislation for consideration by the House of Assembly regarding this reporting. A further commitment was made in the March 2016 speech from the throne. Throughout this time, there has been significant discussion within relevant departments and between the Advocate's Office in preparing legislation on mandatory reporting to the House of Assembly. Since the onset of the process, the primary partners included in these amendments, the Departments of Children, Seniors and Social Development, as well, and Justice and Public Safety, as well as the Advocate's Office, have done much work to advance these amendments. There have been several meetings with the Advocate, Ms. Lake Kavanagh, to update her on government's progress and to seek her feedback on this important initiative. Since becoming Minister of Children, Seniors and Social Development, I as well have met with the Advocate. We agreed to develop a shared plan to continue our work. Areas of mutual interest was discussed, including how to define critical injury and the timeframes for reporting to the Advocate. Today, our government will bring forward amendments to the Child and Youth Advocate Act, allowing for the mandatory reporting of critical injuries, and death of children and youth. Specifically, the 5 amendments we are bringing forward in the House of Assembly are as follows. Definition of critical injury. The proposed definition of critical injury is one that may result in the child or youth's death or may cause serious or long-term impairment to the health of the child or youth. Designated services. The proposed amendment will require mandatory reporting of deaths and critical injuries that occur while the child or youth is receiving services from the Departments of Children, Seniors, and Social Development and Justice and Public Safety, or within 12 months of having received that service. Timeline to report. The proposed amendment will require the Departments of Children, Seniors, and Social Development and Justice and Public Safety to notify the child and youth advocate as soon as is practicable after becoming aware of a death or critical injury of a child or youth. Designated reporter. The proposed amendment will specify that the Deputy Minister of a department or his or her designate shall report the death or critical injury to the advocate. And lastly, protection for employees providing the information. The proposed amendment will provide individual employees who report the death or critical injury with protection from being sued, provided that they acted in good faith. While the advocate and my department agree it is the more serious of these cases that will be reported to the advocate, I want to assure the public that my department will continue to respond to all situations of child maltreatment or situations of harm, and I cannot stress that enough. Our social workers are highly trained professionals who are committed to carrying out the department's child protection mandate. We have been and will continue to be absolutely committed to ensuring the safety and well-being of children and youth in our province. Each situation reported to CSSD is reviewed by a social worker who is trained to review the circumstances of each event and assess the intervention required. Further, my staff, guided by the Child and Youth Advocate Act and provincial policy direction and supported by strong clinical supervisors, will also review each matter to determine if it constitutes a critical injury. It is also important to note that in the absence of mandatory reporting to the child, Child and Youth Advocate did not mean that departments and agencies did not have appropriate accountability measures already in place to respond to critical incidents and deaths. My department is continuing to focus on the transformation of service delivery for children, youth, and their families in order to make systemic change, as well as to create a culture of accountability, excellence, and consistency across all children, seniors, and social development programs and regions. I am pleased and encouraged to fulfill the direction outlined in my mandate letter to work with colleagues and the advocate to develop legislation on mandatory reporting of critical injuries and deaths for consideration in the House of Assembly. We will continue to work cooperatively with the Child and Youth Advocate to achieve our mutual goal of ensuring safety and well-being of children and youth in our province. Thank you.